From the Cronkite studios in downtown Phoenix, this is Cronkite News.
Good evening and welcome to this special edition of Cronkite News on Arizona PBS. I'm Melanie Porter. Thank you for joining us. Tonight, a look back at the health stories that made headlines, from efforts to ban vaping to an invention to help detect babies and pets left in hot cars.
The White House joins in on the effort to ban flavored e-cigarette products from store shelves across the country. This comes as the number of states with illnesses linked to vaping grows to 39. The president of the American Vaping Association weighed in today on the potential ban and efforts to keep the products away from minors.
Cigarette use, yes, is up, and we should combat that with appropriate marketing controls, with perhaps Tobacco 21, with increased licensing and enforcement at the state level. But simply prohibiting flavors used by 13 million Americans, it is a disaster for public health, and it's going to be a disaster for President Trump's re-election campaign as well.
Michigan became the first state to ban flavored vaping products last week, and several other state and local governments are considering similar measures.
And back here in Arizona, we talked to Valley Health experts about the risks of e-cigarette usage and the tracking efforts for vaping-related illnesses. Cronkite News reporter Jennifer Alvarez is joining us live in the studio with what they had to say.
I talked to Will Humble, Executive Director of the Arizona Public Health Association, and he's convinced this is a lot bigger of an issue than it seems, and says that just because our state doesn't have any confirmed cases tied back to vaping doesn't necessarily mean that we don't have any cases at all.
There's really no, what we call in public health, surveillance system in place.
That means there's not a formal way to report or track vaping-related illnesses, like what can be done when someone has measles, for example.
It gets reported to the county health department, to the state health department, it goes to CDC. We have this whole network in public health of surveillance, but it doesn't extend to lung injuries like this.
There have been several cases suspected to be caused by vaping in Arizona, but none have been confirmed yet. The CDC is investigating a multi-state outbreak of lung illnesses associated with e-cigarettes, and so far there have been over 450 reported possible cases, highlighted here in dark blue, and 6 deaths.
This is really the tip of the iceberg, I think. We're going to start seeing a lot more cases identified now that doctors know what to look for when they see reports like this, when they see the CDC advisory.
Health experts are also warning young people about how the unknown could harm them.
It's really dangerous. You're putting your life on the line. We have no idea what the long-term effects of vaping could be or can be on the lung tissue. We just don't really know.
These things are harmful, not just for the lung injuries that we're now seeing, but there is a lot more risk involved with electronic cigarettes and vaping than people really realized. Years ago, when electronic cigarettes first came out, I actually thought that they could be a public health benefit. But what really happened in true life is that the vaping companies, including Juul and others, have been very, very good at addicting young people, and it's going to be a long battle.
The CDC has not yet identified an exact cause for these illnesses, but they do say that in all of these reported cases, the person did have a history of using e-cigarette products. Live in the newsroom, Jennifer Alvarez, Cronkite News.
It's a condition that sometimes doesn't show symptoms, but when people develop it, it's very dangerous and can even be fatal.
Jody Guerrero explains diabetes and what you can do to prevent it.
You feel like you feel really ugly, you feel fat, you feel unhealthy.
Marsha Angulo says her life changed 3 years ago when she was diagnosed with diabetes. She's one of more than 30 million Americans who have diabetes, according to the Centers for Disease Control and Prevention. But before crossing the line to diabetes, there is a condition called prediabetes. Data from the CDC indicates that about 84 million American adults have it, and 90% of them don't know.
They have abnormal result of glucose on their blood test.
According to the CDC, fasting blood glucose levels from 100 to 125 indicates prediabetes. Levels from 126 or above indicates type 2 diabetes. Less than 100 means you don't have the condition. Hispanics have more than a 50% chance of developing diabetes at a younger age. Dr. Mahmoud Al-Sayed from Banner University Medical Center explains the risk factors.
Sometimes also it can be environmental, sometimes be cultural, diet, exercise, lifestyle.
But there are programs to help address this, like the ones at St. Vincent de Paul's Center of Family Wellness.
They learn about healthy eating, physical activity, but then how to actually plan to take into action those lessons that they're learning, as well as we talk about the social emotional part of it.
This is the insulin I have to put right now.
Angulo understands that the disease is linked to mental health and conditions like depression and anxiety. That is the reason she created a blog called Diabetypes.
So I started sharing motivation that helped me. So that's how it started, just like sharing things that help me to help others.
Health authorities recommend people with a higher risk get screened every year.
And the general population should get checked every 3 years.
Athletes take major risks with their bodies to play the sports that they love, perhaps none more so than boxers. While the sport's been popular for centuries, studies about its lasting effects are fairly new. Cronkite News reporter Erica Morris talked to current and former boxers to find out more. Erica?
Yeah, Marcella, anyone can be blindsided by an unexpected injury or illness. For boxers, injuries are part of the job. That's why 2 champion boxers teamed up to tell the uninsured to go ahead and get enrolled. For Layla Ali, the daughter of Muhammad Ali and a former boxer herself, life outside the ring means relying on great health care for her whole family, especially after they coped with Ali's Parkinson's until his death in 2016.
You can't help the fact that you have to see that he got sick. Even being a world champ, being one of the most loved world icons, you know, you can still get sick. Anything can happen. Nobody can run from it. You know, so that really shaped my view of the world and situations that can occur in life.
Current featherweight super champion Leo Santa Cruz recognizes just how tough boxing is on his body.
Also, you know, in boxing, you know, we get hit, you know, so it's very dangerous.
That danger shook the boxing world recently with the death of 27-year-old middleweight boxer Patrick Day on October 12th, who died from brain trauma sustained in a match that ended in his knockout.
You know, that was very sad for boxing. You know, it makes us think, you know, me, like, I was like, you know, I'm doing this, I'm in boxing.
Ali and Santa Cruz shared their experiences in a promotion with the state's health insurance program, Covered California.
Who's ready to do a little workout with me?
About 50 people got in the ring in downtown Los Angeles learning fitness tips and workout practices that utilizes exercise as a preventative measure. While staying fit is a part of it, Ali and Santa Cruz acknowledges that healthcare needs to be affordable.
I have many friends who don't have healthcare insurance, and a lot of times they're telling me they're not feeling well or they're dealing with some ailment, but then they don't want to go to the doctor because they're worried about going in debt over their healthcare bills.
That is, you know, very important for my family because, like I said, you know, my dad, if it wasn't for, you know, us having that, I think he would have been dead already.
And that's a reality they're trying to change. Open enrollment for Arizona closes December 15th. For more information, go to healthcare.gov. In Santa Monica, Erica Morris, Cronkite News.
As parents and their teens celebrate homecoming activities across the valley, some moms and dads may not know exactly what they can be held responsible for.
Knowing the law is just as important as the homecoming dress and crowning of the king and queen. Cronkite News reporter Frankie McLister spoke with one family who's already taking steps to prevent a potential tragedy from happening. Frankie?
Yeah, being proactive is super important. So here's a few tips on how to make this year's homecoming stay on a happy note.
I think any parent, we worry every time our kids step out the door, whether it's going to homecoming, going on a date, going out with friends, going to school.
Which is why Valley Mother Holly Henbest, along with a group of fellow parents, are making sure their kids make it home safely after this weekend's homecoming festivities.
This year, there's a much larger group. There's over 40 kids that are going to be getting on a party bus.
Not only are they being proactive in keeping the teenagers safe, they're also making sure they follow the law.
Oftentimes, parents who don't quite understand how some of the things they do involving their own children or others' children can subject them to legal liability, or how sometimes parents themselves are subject to liability because of the conduct of their children.
For example, if a parent serves alcohol to someone who's over 18 but under 21, they can be liable for serving alcohol to someone who is under the legal drinking age. If someone is injured or dies as a result of alcohol being served, the parent can also face liability. And if a teen is driving a family car that's registered to the parent, that parent is still responsible for that child's conduct while driving.
25% of high schoolers have acknowledged they've gotten behind the wheel. They have gotten in the car with somebody that's been drinking or using.
What if a teenager or parent dealing with these issues needs help, but worry about involving law enforcement?
If there's some legality and some concerns, to seek the support of the school resource officers at the school. They are designed by design on campus to help kids, and they are not going to take action if they're simply asking for help and asking questions.
For Holly and her 17-year-old son Jake, Saturday's homecoming dance at Pinnacle High School will hopefully be fun and safe. That's why contracting a party bus helps in giving her and the other parents a bit more peace of mind.
Yeah, it's more costly, but I feel like a couple $1,000s split amongst the parents for one night is such a huge peace of mind that it's priceless.
Yeah, and it's also important to know that city ordinances change by city to city, and that Mesa Police, they told me today, quote, that they want parents to know it's unlawful for a minor between the ages of 16 and 18 to be in a public street, sidewalk, alley, right-of-way, or other public space between the hours of 12 midnight and 5 a.m. So what I would do, I'd make sure that wherever you live, just go ahead and check and make sure that those rules match up with your city's ordinances. In the control room, I'm Frankie McLister for Cronkite News.
Temperatures seem to be cooling down for us this week, but there are still dangers that can arise for parents and pet owners around the valley. In fact, an experiment done by Consumer Reports proved that even at temperatures as low as 61 degrees, a car can heat to over 105 in less than an hour. Unfortunately, children and pets have died in temperatures as low as 57 degrees, as our reporter Jenna Iannone shockingly learned. Jenna?
Thanks. Even with weather as beautiful as today's, this is still an issue that we need to be concerned about year-round. Check it out. 41. That's the number of times a car door has locked in 2019 in the U.S. with a forgotten child inside, leading to tragic consequences. 3 of them happening right here in Arizona. Climatologist Nancy Seelover explains why tragedies like these happen and how they happen so fast.
Cars heat up fairly quickly, but the issue is that then becomes an issue because the inside of the car gets hot because the sun comes through the window and it hits the surfaces, it's absorbed, the surfaces get hot, and that heats the air inside the car. If the windows are up, or even if they're cracked, the hot air inside doesn't escape and isn't replaced by cooler air, and so it just kind of builds up.
As scientists study the hows and whys of leaving a child or pet forgotten in a car, a market of products has sprung up, including several devices intended to stop hot car deaths from happening. Prescott Valley Police Officer Caleb Cousins explains the system used to ensure the safety of their canines, including his own partner in fighting crime. Chewy.
Ace Canine Hot and Pop is what we run in our canine vehicles. They help us in 2 fashions. One, they alert us if the car gets hot. Not only will they alert us, they'll alert a secondary handler or a designated person that we want a message sent to.
The system alerts the officer via cell phone and then sets off the siren and alarm. It rolls down the dog's window and it starts a fan to cool the car. Arizona police aren't the only ones using these innovative technologies, with apps all over the market that can help remind parents of their backseat babies. Louis Molinari is the CEO of Baby Save, a nonprofit organization that promotes awareness against leaving kids in cars. He says that the solution is not in one single product, but instead in collaboration.
We all need to work closer and share each other's resources, because it is a village that will stop this problem. But right now it's going to take things like Baby Save, things like apps, things like the technology, education, et cetera, working holistically to try to put this problem to bed.
If you do come across a distressed child or pet left alone in a car, Arizona law does protect you. First, you need to call 911, then you may break the window and free the child or pet, and then you just need to stay on site until police arrive. For Cronkite News, I'm Jenny Iannone.
Fear of deportation is keeping some Arizona residents from seeing a doctor. But 5 regional health centers are working to change that and find ways to keep people healthier. Cronkite News reporter Annika Abbott joins us now. Annika, you got a chance to look into one of those programs in Cochise County.
CHEC, a health education center in southeast Arizona, has helped transform the colonia of Winchester Heights by teaching its residents to help one another. It may come as no surprise to you that over 90% of farm worker patients are Hispanic. Overwhelmingly, the top diagnosis for these patients deal with weight-related issues and hypertension. With over 70% of farm workers living below the poverty line, experts say socioeconomic levels and the lack of healthcare access may exacerbate the issue. In Winchester Heights, a handful of people gather in a one-room building reminiscent of a schoolhouse. And in a way, it is. Together, they're learning how to tackle one of the biggest issues in rural areas, access to health care. CHEC, an organization working to bring health services to more people, built the new community center to help the mainly Latino neighborhood, especially local farm workers.
Particularly precarious with farm workers is the type of labor they're involved in, if it's shift work versus ongoing or formal employment. And so some people might have health insurance and health coverage and others may not.
A U.S. Department of Labor survey finds that 53% of farm workers are uninsured. And even if they do have health insurance, the ratio of people to primary care doctors in rural areas is 2,500 to 1.
It's not saying necessarily that we don't have enough health professionals. It's saying that they're not distributed well throughout the country.
Public health expert Jill Guernsey-Dezapian says fear of immigration authorities leads many Latino farm workers to skip seeing a doctor, even if they are legally documented. But there are still more barriers to health care.
But the problem really is more the access to services because of the long hours that people are working in.
To reach Latino farm workers, public health students from the University of Arizona trained a team of neighborhood health educators, or promotoras de salud. Promotoras go door to door in this colonia to teach their neighbors about better nutrition, exercise, and even how to protect themselves against skin cancer.
And then she told me, I am so grateful because I didn't know, but now I know that you have to wear a hat.
Most farm workers in the area are employed at Nature Sweet Farms, less than 10 minutes up the road. 400 people work in this tomato plant. The majority of them work here in the greenhouses, and almost 95% of them speak Spanish primarily. Latino farm workers say the community center and promotoras have made an impact on their health.
It would be good to help with work and for the people to learn more.
CHEC coordinator Linda Cifuentes says promotoras may be a good solution to a common rural health problem.
So I see them as pivotal in other communities who are in the same situation where they don't have support from their local governments or local agencies.
CHEC hopes to turn the center fully over to the community next year. CHEC has been training promotoras de salud since 2013 with the help of interns from the University of Arizona, Mel and Enid Zuckerman College of Public Health. Live in the studio, Annika Abbott, Cronkite News.
Drownings can happen in a moment's notice, and lives can be altered forever. And when it does happen, many are left with the same question: what happens next? Reporter Trey Bates has the story of one mother that has dealt with this unfortunate circumstance. Trey?
As the weather begins to change in the Valley of the Sun, accidents in water continue to happen. And when it came to this mother, she wasn't prepared for what happened next. The day started just like any other for Eliza Casara's heart, that quickly turned to tragedy.
It's too quiet. Where is he? Where is he? And I looked in his hiding places in the garage, underneath the bed. And that's when I opened up the sliding glass door and I saw him down at the bottom of the pool.
Her son, Eric, and his twin brother had been playing at their grandmother's home in Peoria, and what was a normal day turned into every parent's worst nightmare. Devastated by the day's events, she had nowhere to go until the Drowning Prevention Coalition of Arizona reached out to her.
It gave me another outlet. I felt, that first year in a cloud of darkness. I didn't know what else to do. I wanted to protect my other two children. I didn't want them to have the same thing happen to them. It finally gave me a chance to tell my story and know that there's people out there that are passionate about preventing this.
The Drowning Prevention Coalition's website includes reports from January 1st to September 30th where 4 deaths to children under the age of 6 have already occurred, a jump from the previous year in which only 1 child had died in Maricopa and Pinal counties. President Melissa Sutton shared what steps to take to avoid this from happening to anyone else.
A is for adult supervision. That's going to be active, sober, vigilant, and constant, because it just takes a few seconds for a child to slip away, and that's when bad things happen. B is for barriers, and that's going to be your fences, your alarms on the doors, covers over pools. It's going to be a plethora of different selections that people have out there. And then the C is multi-pronged. It's for classes and U.S. Coast Guard approved life vests. We want kids to get started as soon as possible. They've got those swim lessons, so when that motivated child, that highly motivated child, gets past whatever barriers you've put in place, if they fall in, they potentially could save themselves in that situation.
With these steps in mind, as well as remaining attentive around water, John Hinman, director of the EVO Swim Schools, shared his thoughts on child safety.
Never be more than an arm reach away. Always have eyes on the water, always have eyes on our children first and foremost. Get in the water and start training, start learning. Once we start having that basic knowledge and respect of the water, safety builds, and that's the biggest thing. That's what we're about, building that confidence, building that safety from the ground up. That's our goal.
By keeping our attention on the water and those around it can help to avoid life-threatening events from happening. In Arizona, the pool can be a place to gather together and have fun during the hot summer months. But even when it isn't, it is important to remain safe and aware around water. In the Media Center, I'm Trey Bates, Cronkite News.
Native Americans are among the most underrepresented groups working in science and medicine. But a new effort on the Navajo Nation is trying to reverse that disparity. Cronkite News reporter Ricky Cornish is here to tell us about the new program. Ricky?
A $1.3 million grant is going to the University of Arizona and the Navajo Nation's DNA College. They'll work together to help propel Native students into top research universities to study neuroscience. Science. It attracts people around the world, but a new opportunity will give students the option to turn it into a career.
I think everybody thinks, hey, the brain's cool and complicated, and how could you understand, your own mind?
And I think this is the beginning. This is a beginning of a long journey together for great advances in neuroscience.
The grant from the National Institutes of Health will go toward training students in a career field lacking diversity.
When we were doing our research, there was only one Native American in academics who's a neuroscientist. We hope to expand that exponentially.
But the point of this project isn't necessarily to train Navajo neuroscientists. It's to use neuroscience to build a stairway to get our students into graduate school.
The first group of fellows will study in a year-long program that takes place at Dene College during the fall and spring semesters before wrapping up in the summer at U of A.
They will receive a stipend during their time at Dene that frees them up from having to have a job. They'll have housing in the dorms, food in the dorms, and then a stipend for their time here in the summer as well.
Every great teacher learns from their students, and the program will shine a light on the Navajo community.
They're going to be leading us on that journey. And where innovation really happens is actually when you bring these two different bodies of knowledge together. And it's a wonderful opportunity to now return that gift.
The things that my students teach me about their way of life is incredibly rich.
With an emphasis on studying treatments and cures for brain disorders like dementia, the program directors hope to send change makers into the world.
But ultimately what I'd like to do is have neuroscientists that can go back and properly treat the diseases that are inherent in the Native American population.
Help them find a foothold or a fingerhold to begin to climb that ladder of success.
Students must be enrolled at Dene College to apply for the program. At the digital desk, Ricky Cornish, Cronkite News.
Yesterday was World Diabetes Day. The day was created in 1991 in an effort for the World Health Organization to spread awareness about the growing disease. In the next decade, health officials say 1 in 10 people will develop diabetes. And according to the CDC, diabetes is the 7th leading cause of death in the U.S. In the past few years, prices of insulin have increased astronomically, with communities of color suffering from those price hikes the most. Cronkite News reporter Ryan Mushkat spoke with legislators and members of minority groups to find out if there is a solution to the problem.
Alejandro Rodriguez says he was diagnosed with type 2 diabetes 23 years ago. Since then, he has depended on insulin.
I have to touch people's hearts, and they help me to buy the medicine I need.
According to the American Diabetes Association, the average U.S. price of the 4 insulin categories increased by nearly 17% per year from 2011 to 2016, something that creates a big problem for Rodriguez.
I don't have any money because I don't work, and because I don't have any government help.
People like Rodriguez struggle to pay for insulin, and last year, Arizona Department of Health Services reported that communities of color in Arizona experienced some of the highest rates of diabetes in the state. He says he hopes state legislators do something to lower the prices to help keep him and those who also deal with this disease alive.
You know, as far as the state level, it's really difficult for us to set, a price on insulin. That's more of a federal issue.
Senator Heather Carter joined the American Diabetes Association in combating the high cost of insulin. In a statement, she says virtually every Arizonan knows somebody affected by diabetes, and finding them access to cheaper alternatives is the right thing to do. For now, Rodriguez has enough insulin for the rest of the month. He says he feels positive that he will continue to have a full life and is hopeful for his future to come. In Phoenix, Ryan Mushcott, Cronkite News.
The World Health Organization said on Wednesday it would begin the process of testing and approving a generic version of insulin.
That's it for this special edition of Cronkite News. Thank you for joining us. For top Arizona stories anytime, go to cronkitenews.azpbs.org.